Now we have news from Singapore. During this year's Asia-Pacific Mental Health Conference and meeting, Singapore President Halimah Yacob said that the intersectional nature of mental health issues requires a nationwide effort to overcome.
It is a tricky word. I would have problems with that one too. She also added that she was particularly concerned of challenges faced by the youth. And she further noted that from 2015 to 2020, the number of adolescents in the Institute of Mental Health for Depression has risen by around 60%.
To help uplift the capabilities of the social sector, I recently invited IMH to partner PC in developing a pilot curriculum that can better prepare SSAs in the case management of youth with mental health conditions. We have decided to focus on youth for a start, as I am particularly concerned about the challenges faced by our younger generation. Over the 5-year period from 2015 to 2020, the number of adolescents seen at IMH for depression has increased by about 60%. Anecdotally, we also hear of more students facing stress-related issues over time. We need to do something urgently as a community to arrest this trend. I urge our SSAs to join us in this project to help our youth who are facing mental distress.
And I'm going to add to that a report I read from UNICEF that said it may take years to actually measure the extent of the pandemic's impact on our youth and our children as well. Psychiatrists quickly saw signs of distress with children and adolescents seeking help for suicidal thoughts, anxiety, eating disorders. So there are a lot of things that happened as well, and other difficulties as lockdowns and switching to remote learnings had severed them from friends and routines, along with losing family members as well. I mean, this is very hard on us as adults. I can imagine how it is for kids. Now, pediatric psychiatrists say they were already short of resources before the pandemic brought on a surge in caseloads, and spending on promoting and protecting mental health is extremely low, yet the needs are very pressing. So some figures for you guys. Pre-pandemic, 2019, there were an estimated nearly 46,000 children and adolescents ages 10 to 19 around the world who end their own lives every year. So this is a very high number even before the pandemic began. There's been worries about the mental health condition from anxieties, from illnesses, lockdowns, school closures, and other changes in their lives. And these lockdowns fueled behavioral problems and were particularly hard helped by kids with autism and attention and hyperactivity disorders. You can imagine if you lock up a kid who is hyperactive, they're going to get even more so. And then remote learning is also very out of reach for those that are poor. There's millions of young people around the world that are unable to access it because they have no internet access or television. Even when you're not forced out of school, I'm talking about the poor kids, some of them have to drop out of school and work to help make ends meet. There are approximately 142 million children are thought to have slipped into poverty last year. And last but not least, and this one's going to hit close to home as well, financial hardship and school closures could also put more girls at risk of being forced into early marriage. And this is something that we don't even think about, but we're talking long-term impacts of what could happen years down the road because of this. And even though we always think in the beginning, children are less likely to have any fatalities as opposed to someone who is a senior, we don't realize that some of these effects are more longer term because an older senior would not live as long as what a child would from this time.
That's true. And it's also a reminder for us to check on our loved ones, to communicate with them.
Yeah, people need human connections.
That's and you know what, mental distress, especially during now in this age, is so different than when we were back when we were children. Bullying, let's say, as a case. Beforehand, it was confrontation. Now, everything is throughout social media. It's cyberbullying. So it's more easier for them to attack our children, attacking youth or between them each other. Before we have to meet up with each other and we have to have that conversation.
I'll wait for you after school.
Exactly.
Now they can.
And there's a lot of suicidal children or suicidal youth now because of that, because they can't come forward to the parents, and the parents cannot come forward, especially during the pandemic, right? You can't have a face-to-face even from parents to parents. So the problems are not occur. So that happened when she or he or the children cannot take it anymore, and they just take the very simple step, and that is suicide.
You can really get lost in that digital world. So please, if you guys have kids, I've allowed my kids to use gadgets younger than I would have liked, but at the same time, we kind of monitor. Like, I feel creepy sometimes to have to check the phone to make sure the screen time's good and all the actions, but it's something we need to do as parents. And anyway, another thing that we talk a lot about, other than COVID-19, especially recently, is climate change. And a lot of people have joined in the fight against climate change, and it's not just humans anymore. Apparently, animals have as well.